Welcome to Doctors on Call. I'm Dr. Sameer Gupta.
And I'm Dr. Sonalal Gupta. Today we'll be talking about aspirin, which is often referred to as the wonder drug. Now, aspirin is commonly known as Ecosprin or Dispirin in India, is a pain reliever, a heart attack preventer, a fever reducer, and a cancer preventer. All these features all rolled into one tablet.
Now, being a cardiologist, I have first-hand experience, and I can tell you, heart disease is rampant in India. Now, people who have heart disease are often given aspirin as a part of their regular medicines because aspirin thins the blood and reduces the chances of having a blood clot. Now, people who have heart disease, their family members and children are also at a higher risk of having heart disease. And they often ask me, what can I do to reduce my risk?
United States Preventive Service Task Force came out with a recommendation that anyone who's above 50 years of age or anyone who has more than a 10% increased risk of having cardiovascular disease should start taking a low-dose aspirin every day. This would help you in the prevention of having a heart attack and a stroke and also decrease your risk of having colon cancer.
So the question is, should you take an aspirin to reduce your risk of having heart disease or stroke? Let's find out. Clotting can happen in the vessels that supply your heart with blood. If your blood vessels are already narrowed from atherosclerosis, which is the buildup of fatty deposits in your arteries, now this fatty deposit in your vessel lining can burst and cause a blood clot to form quickly, preventing blood flow in the heart and causing a heart attack. As aspirin works as a blood thinner, it reduces the clumping action of the platelets, hence prevents the formation of blood clots, possibly preventing a heart attack by almost 20%. On the contrary, clotting is important as well. Normally, when you bleed after getting an injury, your blood's clotting cells, called platelets, build up at the site of your injury. The platelets help form a plug that seals the opening in your blood vessel to stop bleeding.
So aspirin acts as a blood thinner, preventing the formation of clots both in your heart and the brain. But in some people, it can cause serious side effects like increasing your risk of bleeding. When you take an aspirin, it does increase your chances of bleeding, more commonly in your stomach and sometimes in your brain. Aspirin can also cause stomach ulcers, but the actual risk of bleeding can vary from person to person depending on multiple factors. Now, just because a medicine can cause problems, it doesn't mean that you don't take the medicine. In the right patient, the benefits of aspirin definitely can outweigh the risks. In fact, taking a small dose of aspirin, like 75 milligrams, is endorsed by most major medical societies all over the world for preventing a heart attack and a stroke, especially if you have risk factors like high cholesterol, smoking, or diabetes. Please don't start taking an aspirin without consulting your doctor. Depending on your risk factors, your doctor will decide whether you qualify for a daily aspirin or not.
Now, if you have heart disease or stents in your heart, chances are you're probably taking an aspirin every day. It is important to remember not to stop your medicine without consulting your doctor.
Now, if you're already taking a daily aspirin, that does not mean that you neglect the other aspects of living a healthy life, like a healthy diet, daily exercise, and overall just living a healthy life in general.
After all, at the end of the day, that's what helps you the most. See you next week.